are there any safety concerns when it comes to pregnant women and COVID-19 vaccines?
Okay, thanks for the questions, Afrin. For you, I think you shouldn't be worried. Yeah, there's a lot of data on this. As long as your pregnancy is above 12 week and above, yeah, all vaccine is safe for you. Even the mRNAs, such as those brand with using mRNA method, also is safe for you because the baby's bone and organs are already well formed, so there will be no harm to the baby and as well as yourself. Because compared with the risk of not vaccinated, pregnant lady have a high risk of getting COVID and COVID death. The risk is much more higher, maybe 24 to 34. So I think you have done a very good job. You have your first dose already. Yeah, just continue with your second dose. And even when you have, pregnant lady, when they want to go for delivery, that time, they need to go to hospital, right? If you're vaccinated, definitely you're protected yourself from getting a severe disease. That is also a way of how to protect you and your baby as well. And no worry about the baby. They are they are no harm at all for this vaccination, and they won't cause any mutation or anything or cause harm to your baby. So for me, this is why DG yesterday talked about this is because there is currently there's just share with you there's 78 cases of pregnancy death, yeah, which is very unfortunate. And or is not vaccinated, yeah, or not really properly vaccinated, which is only one dose, yeah, and they already in the delivery state, yeah. And also that even if you already received your first dose, you are not fully immunized, so you need to very carefully protect yourself. Don't go out and don't meet any strangers, or try not to eat out. Also wear your mask 24/7 if possible. Wash your hand. And try not to, off your mask while talking to anybody, even though your families who are not staying with you, or those who have worked, those family members who work in the working place and then they always need to come back home. Try to avoid, to have a constant contact with them because this is a risk for you to the risk that can transmit COVID. Yeah. So 30 weeks is good. Then you just need to have a second dose, and then you should good, and you can go for a safe delivery. Yeah.
By extension, is it safe if you're trying to get vaccinated if you're trying to conceive or you just found out that you got pregnant?
Okay, there's two things here. Yeah, pre-pregnancy means that you might you plan to get baby. Yeah. So the first advice is that if you plan to have baby, definitely you are advised to have your 2 doses of vaccine first before you do conceive. Yeah. Even you want to do for test tube baby or you don't want to induce, you also need to properly vaccinated. Only plan for that. This is the first advice. This is similar to our our KKM recommendation for those who are already pregnant in the first 12 weeks. Okay, the first 12 week is the most vulnerable time for the baby to get when you get vaccinated. That's why until now we still not enough data to support the vaccination of less than 12 weeks pregnancy. Yeah, if there is a lot of indication, means that the patient is high risk. They got the mother have a heart disease, have even chronic disease like diabetic or they need protection early. Yeah, so the vaccinator means that the hospital will give you explain the risk, all these things, and discuss properly. Yeah, before they give the injection. There is data, a very I call it a very little data on 12-week pregnancy, but there is, but it's not enough to prove that it's safe. But there is show some positive trends of less than 12 weeks pregnancy getting vaccine still protective and safe for baby. But this is very scanty data. We cannot recommend that yet. So for us, for the 12 weeks and below, please protect yourself as if that you are not vaccinated, like 24/7 wear mask, not to meet any strangers, don't go out, sanitize your hand, every day, you know, and try to avoid to talk to any person who work outside and come back to home. Try
I know
not to.
I know this is going to be a tough question because you're talking about like the data, but why I asked it was because someone asked, I didn't know that I was pregnant when I had my first
That's
dose at
okay.
week 1 and week 2. Should I continue to take the second dose?
Okay. Definitely, the second dose need to be deferred. I know that we had few because previously also I did have follow up a lot of vaccinated uh, uh, group of people. Some of them during the first dose, after the first dose only confirm pregnancy. Yeah. So we defer the second dose until it's more safe. Meaning that after 12 weeks of pregnancy only for the second dose. Yeah.
So
So
Alicia should wait until her.
yeah, Alicia should wait now. Yeah. Don't go for the second dose until. But I think you should consult the ONG specialist first before I because case by case basis. Yeah, Alicia. I'm not saying that I am expert, but I just want to let you know that you need to consult your ONG specialist first before follow what I said.
Yeah,
Yeah.
I think consulting would be better to always get a more
The second
information.
opinion.
Yeah.
Yeah, for
Yeah.
information and the your ONG specialist will be more more understand about this situation. Yeah.
Mm. And again, sorry again, by extension also breastfeeding. What about breastfeeding mothers?
Oh, hi, Michelle. Yeah, sure. Breastfeeding. Currently, there's a lot of evidence showing that breastfeeding mother is suitable to get vaccinated, and it won't affect the baby at all. So as long as after delivery, and your body is okay, meaning that you feel strong enough, and no more, confinement is quite tough, right? During the confinement, if you feel you're more, say you're healthier back, you can regain your body energy, or your regains from the delivery, post-delivery tired and healing, then you can immediately get your first jab and second jab. Yeah, no problem at all.
Now, is there a vaccine preference for pregnant mothers or breastfeeding mothers, or all kinds of vaccines would be better than no vaccine?
Oh, currently all vaccines suitable for breastfeeding. This is a good news. So there's no any which is better. So our currently in Malaysia we offer all vaccine is suitable for breastfeeding patient.